Hi, I'm Dr. Lisa Konick of Konick and Associates. Welcome to our Ask an Expert Parent Education series. This episode, this series that we're doing right now is on recognizing risk behaviors in teens. And today's topic is the impact of substance use on the brain development of adolescents. And today I have with me again, Amber Konopa, who is our substance abuse counselor at the practice.
Hello.
Amber, I'm going to introduce Amber formally in a moment. I want to tell you a little bit more about our practice and why we were offering these talks. Konick and Associates is a family behavioral health practice in Naperville and Orland Park. We specialize in families and individuals across the spectrum, and we have a large population of adolescents in our practice. And with adolescents comes parents who are concerned about their teens. And we also specialize in psychological and neuropsychological evaluations through our Center for Testing. And one of the reasons we thought it was important to offer this series on risk is due to the increase in substance use in the community at large due to the COVID pandemic. And also kids are struggling with coping. There's lots of changes that are going on, and we're seeing some increases in their risk status, especially at this time. Amber can attest to that. So Amber, I'm going to introduce you. Amber specializes in substance use and co-occurring problems, including anxiety, depression, challenging behaviors, and treatment-resistant issues in adolescents and adults. Amber is a clinical professional counselor, a certified alcohol drug counselor, and a certified recreational therapist. Amber, tell us a little bit more about your background and how this talk kind of fits in.
Sure. Can I put you on hold for a minute?
Little emergencies when we do these online.
Yes. There's a Roomba that tends to go off. And so anyways.
Excitement in the household.
Yes.
Go for it.
Anyway, so
tell us about you.
Yes, absolutely. Thank you all. Today is an interesting topic that can be very misleading with all the information like we talked about last time, and this time with the brain and the connection with substance use and what it does for an adolescent. And not only with the adolescent, but the significant people who are attached with the teen as well. And so over the years of working in various places, from inpatient to detox and also outpatient, when this topic comes up over the years, people are very not looking forward to it, because sometimes when we hear dry educational information, it's like whoo, goes over the head. And so I can only speak from the people that after hearing disease education, they're like, man, I really like how you break it down. And so Lisa and I are going to give examples and situations where you can understand it personally. And with this, it's keeping it simple, because like you, if I don't know how to apply it to my life, it's not going to happen. And so, and another thing with education is knowledge is power. If I don't know what's going on, what's going to motivate me to make changes? Because the connection with substance use and the brain is very powerful, and it affects people in many different ways. So thank you for joining.
Yes. And, Amber, I appreciate that, because, when we talk about adolescent development, we're going to give you a little prelude by talking about the developing brain and why it's important to consider some of these things in the adolescent. Why is substance use? Adolescents are very flippant about, this isn't going to apply to me. The scary stories, the dare stories that you might get in early childhood, elementary age education. Adolescents do not, as an egocentric part of development, do not think that this applies to them. It applies to other people. So all of these examples that you may give as potential scare tactics, and Amber mentioned that last time, those don't really work. So let's talk a little bit about the adolescent period. Amber, tell us a little bit more about what's going on in adolescence from a developmental perspective. Let's talk about that together.
What is not happening during the adolescent period? There is so much going on, which is a really trying time, because Here you have, so just developmentally speaking, this is a time for identity formation, figuring out my values, figuring out what's important to me, separate from my family, and developing an overall sense. So with that, during the teen times, you also see risk taking, because I am now becoming, which is the next stage, an adult. And we carry all this information with us. So the wild thing about adolescent, and now I'm going to try and experiment with substances, my prefrontal cortex is now developing, and it doesn't develop until the age of 25, 26. That is a significant time period of if I am dabbling in risky behaviors and or with substances, this is going to hijack my prefrontal cortex, frontal lobe, and then my other parts of my brain are going to respond because of what's not happening now in my prefrontal cortex. And that's why it's so important to have appropriate modeling behaviors, support, knowing who to reach out to if there's questionable behaviors that you're seeing at home or at school for that matter.
And to speak more about the frontal lobe, so if families don't maybe know about this, there's this term that you may have heard called the executive functions system.
Oh, yeah.
And the executive functioning system is our higher order facet of our brain, and it is the frontal lobe. This whole frontal area is what differentiates us from, animals, primates, etc., where we are, it's that part of the brain that has to do with problem solving, time management, initiation of motivated behaviors, critical thinking skills, planning, behavioral inhibition, so impulse control, all of the higher order thought processes are in the frontal lobe, and they are blasting out in adolescence. So we're really kind of emerging. These are all emerging skills that if you think about the differences between your elementary age versus middle age, just going into that pre-adolescent period, they're moving from concrete thinking to critical or analytical thinking, and they're moving into that abstract thinking process. And unfortunately, if many of you have talked with your teens, they think they know a lot more than adults. They have some ability to think through things, but they're not quite mature enough to understand their own limitations. So they have a little pocket of knowledge, and they think they know a lot about the topic. So I think that makes the whole concept of substance use discussions challenging. A lot of times what we see with that emergence is that, there's some immaturities that many adolescents are not aware that they still possess, because that process, like Amber said, is a developmental process from preteen all the way into early adulthood. It takes a lot of time. So when we think about when we're the other concept I want to introduce is neuroplasticity. And what that means is the brain is being very adaptable and malleable throughout this process. So a healthy development, we want to see that kind of progress developmentally without substances in play. When we add substances to the mix, what are we doing to the process of the way the neural pathways are being formulated as we add illicit substances into that process? So that's the challenge. And I know there's families have talked about, well, what about medications, prescription medications? Wouldn't these do the same thing? We're going to talk about that in a few minutes.
And Lisa,
Amber, do you have anything else to add to that developmental discussion?
Yeah, going with the neuroplasticity. So if there are people on here that are like, well, this is only for the adolescent brain. Actually, no, it actually applies to people of all ages, because working with adults, they're able to go back to their teen years or times of where at the time, we only know what we know, right? No matter what age we're at. But the scary thing about the brain is that you don't know what's going to happen as you get older. So the neuroplasticity, that is an amazing research out there that talk about that. But if I have damage done to my brain due to different types of behaviors and or substance use, once damage is done with the brain, it has a hard time repairing itself. And that's why knowledge is power. That's why it's getting the word out and trying to keep it simple with this information, so that way it reaches people so they know, hey, what's going on. And even if you are an adult tuning in, there are ways that you can get the brain stimulating in different ways. So
yeah, I think the whole goal is to try to circumvent some of these challenging, risky behaviors in teens before it does become permanently challenged. And so let's talk a little bit about experiential learning, Amber, because there's different thought processes involved in the process of addiction and substance use, the developmental course of substance abuse to addiction. So I think let's talk about the various learning pathways that influence. So we have experiential learning, we have classical conditioning, and we have operant conditioning. So we'll start with the idea of experiential learning. And I think about kids, we tell kids, educate your kids. Parents are always trying to help their children understand what not to do. Guess what adolescents want to do? They want to learn by experiencing things on their own.
Right.
So tell us a little bit, Amber, about that with substance use.
Well, I like to start off before we go into the education is I want you all to think about something that you really, really like. That could be food, that could be some sort of pop, and think about that that connection. Over the years, you really like, so I love pasta, okay? And so the smell of pasta sauce getting made and everything and the whole process of it. Okay, so now let's say years go by and now, hey, you're told, all right, you can't have pasta anymore. Or, that pop that you like, well, now you can't drink it anymore. So a lot of stigma is around where, well, you need to just stop. Can't you see what you're doing? Well, that's another reason why we're talking about this is that people can't stop, because that's the importance about with what you were saying, Lisa, is that we have this experience, we have this learning, and that all plays a part in our brain. And so then now I have to stop. Okay, what goes on now? Well, now we have the classical and operant conditioning. So at one point, pasta, my pop, or having a cigarette after I eat dinner was just one of those things. And now it was unconditioned at a time. And now over time, the pattern and cues that we get from our outside world, cues from our internal world, they're still there. And so then naturally, we have what's called operant conditioning, where we reinforce things, our behaviors, like sometimes subconsciously or consciously. And so that's why external factors such as going to a person who is certified in alcohol and drugs is so important to teach this so people can get themselves back into recovery, and to also teach families or significant people in one's life, even if you don't have family, you have significant people with you, to understand, hey, here's how to assist and here's how not to assist as well.
Yeah, and I think when we think about these different facets, just using that pasta example, I think whatever your favorite food is, chocolate, for example, a lot of people have a hard time resisting a nice piece of chocolate. You see the candy bars in the grocery store, you're triggered. You may smell or watch somebody eating chocolate, watch a commercial on TV, see a friend or somebody in a restaurant, you see that chocolate cake going by, thinking about pasta and all the aromas, and being in an environment that's triggering not only the senses, so your sense of smell, your vision, your taste buds start to activate. So that's a conditioning factor. So the vision of a neutral stimulus, which is seeing pasta walk by on the waiter's tray, is triggering the salivation. That's Pavlov 101, right? The conditioning experiments that were done many years ago to see those connections that are being made. So, thinking about your kids and their use, where are they being triggered? If they are doing some experimentation, and just to mention, kids that are experimenting with substances do not necessarily develop a substance use disorder. They could just truly be doing a little experimentation, and they are able to keep it under wraps because they want to fit in. Not that that's a minor thing, but it is something to talk to your child about and to not get overly alarmed. But if you start to see them connecting a lot of those patterns in place, that's where some of those, peer factors can be, being consistently involved in environments, not being able to manage stress. And I also want to mention about who are the models in their life and what are they observing in their environments. So in their peer environments, if they're spending a lot of time with peers who are models for them and they're not coping well and they're coping with risky behaviors such as substance use, those are going to be appealing ways to cope with stress. Again, with home, how are parents coping with stress? How are family members and siblings coping with stress? How are you managing responsibly or irresponsibly with substances in the home? And it's really hard if you have a parent or a grandparent who is a smoker and you tell your kids, no, it's not a good idea to smoke. They're at that abstract thinking stage, that critical thinking stage. They're putting these factors together and making decisions on their own about that.
And if I may, and that's why there's a lot of myths and a lot of opinions about the 12-step program and AANA. And it's an amazing program, and it teaches. There's a lot of or Smart Recovery or True Refuge is another awesome support community where they naturally talk about this type of learning through the 12-step program and the way they teach to be aware of your people, places, and things. Be aware of how you're not trying to trigger yourself, but how to be aware of it so I don't put myself and my body at risk with what's going on. So sometimes it can feel very daunting if you're a parent or if you're watching this going, well, I have no idea what to do. I'm at loss. Well, that's why we're putting our information out there so you have a place to turn to and to ask questions and whatnot.
So I want to mention a little bit more about neurobiology here. So let's get into the brain development. So we talked about operant conditioning a little bit. Those are reinforcing behaviors. So that's external behaviors, how you could be reinforced. I'll give an example of an environmental component here is maybe with a peer group, and I'm reinforced when I'm, smoking marijuana with my peer group because they're accepting of me. So that's reinforcing. What's happening in the brain with those reinforcements? So let's talk a little bit about the neurobiology and then also some of the chemical processes that are going on that are hijacked in this concept of substance use. So neurons are cells in the brain. So we're talking about anything, it's talking about brain. Neurotransmitters are the messengers, the chemical messengers within the brain that do lots of things. So some examples would be dopamine, serotonin, norepinephrine. These are chemical messengers in the brain that are regulating something. So they're important for regulating mood, regulating attention, behavioral inhibition. What was the other one, Amber?
Pleasure.
Pleasure is a big one when it comes to substance use. So the interesting thing about the neurochemistry of the brain is our brain actually, and our body has hormones or neurochemicals that actually are natural regulators for us. They're natural feel-good chemicals. And so dopamine, for example, is part of the reward center of the brain. And there are natural things that we can do to stimulate dopamine. So completing a task, having something that puts a sense of achievement into place, self-care activities can be involved in stimulating that pleasure center of the brain. Doing an artistic project, getting a good grade on a test. It's going to be individualized, but these are things that might stimulate that pleasure center. Serotonin is a mood stabilizer. So and it can be implicated in other things as well, but things that could stimulate or regulate serotonin could be meditating, running, sun exposure, walking in nature, things of that thing, calming strategies. Oxytocin is a love hormone. You can get oxytocin from playing with your pet, hugging a person, being affectionate with someone that you care about, giving compliments. And endorphins are our natural painkillers in our brain. So those are things that can be activated actually with laughter, with exercise, and we can activate some of those natural chemicals. The problem is these chemicals in our brain are transmitted, and there's neurons that send the message, send the chemical out, and there's other neurons that have like a docking station. So I got to go this way. The docking station is where we receive that chemical. So that's how cells communicate with one another. And we want that flow to be smooth. In some situations, stress, depression, intense anxiety, we can get depletions in some of these natural chemicals. And so we want to have healthy coping strategies to continue to activate, or with medications that are prescribed medications. Those prescribed medications can help to supplement those neurotransmitters and those neurochemistry until we're able to regulate on our own again. So they're supplemental. Challenges come when we use substances of abuse. Amber's agreeing. She knows where I'm going with this. They're going to hijack the process.
Yeah.
So you're now got, this binding site that wants to receive serotonin, but you filled it with something else. So now serotonin, using that as a general example, can't be received by this other nerve cell or neuron. So we're getting some depletions here because some of the substances of abuse are taking up that space, and we have natural challenges. So, do you have anything else to add about that, Amber?
You asked such an interesting question. The crazy thing about substances is that it works with the neurotransmitters. So the first time I use, and this is where tolerance comes in, and why tolerance is very dangerous, because tolerance, so here's what goes on. So now I use something for the first time. It may not reach my brain the first time as something really powerful, but for some substances, it can be extremely, so if my baseline for my neurotransmitters is right here, but I take something and it brings it way up, that now that natural dopamine, I'm going to use dopamine, the pleasure.
Dopamine's the best example.
It's going to go way up. And that's how I get hooked on the dopamine. And then my natural way of my body having pleasure is now depleted. So then I go back. That's where you have people say, why do you keep going back? I'm chasing that first euphoric experience. And that euphoria is very powerful. And sometimes, and a lot of people, no one says, I'm addicted now. I have this substance use disorder and all these consequences. No one says, yes, this is what I agreed to, or else I wouldn't have done it. And once that connection happens, that's why there are so many ways and strategies to assist people for relapse prevention and to align with my recovery behaviors. And I take a lot of pride in that. And I wouldn't be doing this for 20 years if I haven't seen people make such remarkable, young and older, even teens that I've worked with, just make strides and just say, man, my quality of living is back. And then seeing the natural feel good neurotransmitters come back. And besides the psychotropic meds that you were talking about, and with research, which is absolutely amazing in the addiction world, is that you have MAT. MAT stands for, medicine assisted treatment. And MAT works with the receptor sites in my brain to reconnect in different ways with counseling. Medication's not 100%. Just like teaching people with mental health and coping, got to adjust the behavior. Medication with MAT, and MAT, medicine assisted treatment, works with alcohol and opioids.
I want to
Yeah.
add to that because I agree with you, Amber, that the pleasure center is one of those features that is so heavily triggered with substance use. And when you are using a drug of abuse and it's over activating your natural system, it becomes very alluring because you can't get that feel good feeling without the drug. The other problem that I want to add to that is, I think of cocaine as a great example with that dopamine surge is well over and above anything you would feel naturally. But the drawback is the after effect is a crash.
Yes.
And the crash is for some of these drugs of abuse is where you are getting increased mental illness because they can create intense anxiety symptoms and they can also they can intensify depression. So you're not only getting, if you're already stressed and you're using drugs and you're getting the high, I've got to go this way, then you're getting the crash, you're getting a bigger low. So now we're dealing with that, what we call dual diagnosis. So we're dealing with the substance use treatment as well as the anxiety and the mood related symptoms.
And if I can, that's an excellent point with withdrawal, is that a lot of people say, oh, well, I'm going to manage these withdrawal symptoms on my own. And that can be very deadly. And that's why it's important to get medical treatment, see a doctor, go to the hospital, because alcohol and in our last talk, benzodiazepines, those are the two substances that people have to be medically hospitalized because of seizures for both benzos and alcohol. And also with alcohol is DTs, delirium tremens. And so, and the withdrawal piece and the pleasure piece, it's a very friction, conflictual place to be once those patterns of use and my pleasure center becomes activated. That nucleus accumbens, if you will, takes over, hijacks my frontal lobe, and now it's pleasure, pleasure, pleasure. And that's why sometimes people are like, I can't believe you're making these choices. What is going on? That's because my value and my moral and abstract thinking has now gone down because my pleasure center is activated. And what do? We do what our brain is telling us. And so, and that's why understanding that connection with, okay, I have these natural feel good, and okay, this really makes me think twice about, what type of behaviors I'm engaging in. And so hopefully this really inspires people to figure out, okay, what's the quality of living that I deserve, and not to wait too long, because intervention only works, it can work, but that's why we're doing this, is to do prevention.
Yes. And, I think when we're talking about these, this marriage, I guess, between the neurochemical, the emotional, and the environmental aspects of the development of addiction. The other thing I wanted to add is this kind of pertains not only to drugs and substances. This pleasure center being activated, for example, is one of the factors that also influences gambling addictions, sexual or pornographic addictions, eating, gaming. We talk about adrenaline junkies.
Yep.
There's that high that they receive from these risky behaviors or whatever the other behaviors may be they're engaging in. And what makes it so difficult for them, even though they know what they're doing may be frowned upon or dangerous for them, it's really hard for them to cease without interventions in place, to understand how to cope with the stressors or the triggers that might be activating them. But then that pleasure center being activated has been kind of overridden by the activity or the substance. So it's really hard to regulate again. And it can happen with intervention.
Yeah. And, and then let's throw another sprinkle on top of all the other factors, is that now I stop using, and this affects young and older people, and a lot of people are not familiar with it. It's called PAWS. PAWS stands for post-acute withdrawal syndrome. PAWS symptoms are wild as well. because a lot of times I haven't, for a lot of people, I haven't stopped using long enough to experience this. And when I say, okay, enough's enough, a lot of times pause symptoms is what brings people back to using, and which is very dangerous, because once my brain knows tolerance, this is why overdose, my brain is saying, okay, I can take this, but I haven't used, and now I'm going to go back and use, and my tolerance is just going to be, it's going to be shot. And now I'm going to be not only using more, everything else is going to be added upon it. And so pause symptoms can last for a long time, up to 10 years, if not longer. Some people experience intermittent, and the pause symptoms, post-acute withdrawal syndrome, are a set of symptoms of mental health, mental, emotional, the physical symptoms like night sweats, dreams, stress sensitivity, my gait, and the way I think. It can be clouded, can look impulsive. So if I have underlying factors that can really affect the pause symptoms as well, medically and psychologically too.
Amber, is this what people that use hallucinogens experience, kind of as a, you hear people that have used hallucinogenics that may later have like a flashback? Could that be caused by this syndrome that you're referring to?
Yes.
Even if they're not using, they get that kind of, they can hallucinate even after ceasing the drug.
Yes. And what is also, thank you for that, which is also really scary that I have seen with the psychedelics and other, is that, like, let's say I have this predisposition for schizophrenia, and hallucinogens are quite powerful, where I have seen teens, even with cannabis, mind you, that when they start smoking, they experience hallucinations. But part of our experience as a teen, it's new, it's exciting, and colors, and, you know, all this stuff that's portrayed on music and movies. Well, now I'm going to want to engage in this, but you don't know what can happen to the brain, where once you experience some of these mental health symptoms, it's really difficult to not experience that. And some people, you know, feel like, oh, you know, if I can just socially do this, but I don't like the emotional, mental aspect. It actually scares me, you know, that's not going to engage. So yeah, that psychedelic piece is, and especially with the developing brain, that can really have, it can really add the effect of it.
Yeah,
people are not always expecting.
Well, let's think about, for parents, how do we want to wrap this up? Well, what can parents do to help their teen or family member if they're concerned about some of these? You know, we talked about experiential learning, so your kid may not necessarily even listen to this discussion and think that it applies to them. But as Amber mentioned, knowledge is power. You know, our last talk talked about the do's and don'ts for how to connect with your child about discussions related to substance use. And I think really, Amber, what would you suggest in terms of what can they do at this stage if they're concerned?
Yeah, you know, a lot of, and it's interesting running groups with mixed ages, which I actually like, is that you have the young learning from the older, and the older sharing their wisdom and knowledge to the younger. But the collective whole is, I want people to talk to me. I may not show you that I want to hear your concern and all this kinds of stuff, but it resonates with people. And again, like we said in the last topic, don't say, you know who you know, or do you see what they're doing, or, you know, coming at a person. You want to try to meet them on the same level and talk to them about your concern, your care, you know. And also, NIDA is a great place to get educated on the brain. They have like short clips. NIDA is National Institute Drug Administration. And you know, and another awesome place is, depending on the 12-step meetings that are in your area, if you identify as having a problem with substances, you can go to a closed meeting. Now, if I don't, but I want to get educated, go to an open meeting. anybody can go to an open meeting. And when you find the right meeting, and that's where I say to people, you got to shop around, just like finding a counselor and a doctor. There's a lot of people out there and you just don't know. Shop around, ask around, because you're listening to the fellowship talk about their experience. And it's amazing what people have done to get out of a place where they've been at that still is with them, but the relationship with their life and themselves have changed. So there's a lot of it. TED Talks are great as well to get educated on. SAMHSA, Substance Abuse Mental Health Agency, it's SAMSHA, and they have a lot of information on there too. Hazelden, Betty Ford.
Those sites have a lot of informational resources. The other thing that I know parents have done and they've asked us about is there are some of the substance abuse treatment centers that do outpatient, which is called an intensive outpatient program, an IOP program, or that offer adolescent groups. They will do a level of care evaluation with your child and talk to them about what they perceive to be the level of risk if they're developing risky behaviors, and they will be able to provide that feedback to you. And a lot of times those are at no charge.
Right. And in the substance use realm, we use what's called ASAM criteria. So when you go to get in this, and you can look this up online, and it's a dimension, it's a 6 dimension where you look at different factors in a person's life. So it's not the counselor making the recommendation. The counselor is supposed to be using ASAM criteria to look at, okay, what are the protective factors? What's the risk that's going on? Because that's why, and good point with that assessment, Lisa, is that finding the appropriate level of care is what we want to promote for recovery, to prevent relapse prevention skills and whatnot. And sometimes family, yes, you are putting your trust and faith in us. And that's a responsibility that I don't take lightly, because, parents can only, and the family can only do what they can do. And that's where having places like this and other agencies to help a person in their life.
And as you're speaking about this, and I think about you can only do what you can do, we're dealing with, when it gets to a stage of concern where if there is an addiction in play, it isn't about how much I love you, so I'll quit. There's so much overriding that. The powerless piece is kind of the neurochemical aspects of the addiction. So I think one of the things we can do as parents, as we see some of these emerging concerns, or if you're concerned about substance use, is to help your loved one, your child, your family member, find ways to trigger that positive reward system environmentally, which is where I think we talk about healthy coping strategies, model healthy coping strategies, be available without being critical in terms of how to communicate with your teen, be present, listen to them. I think parents get anxious and they kind of press too much information, like your grades, your peer group, there's a lot of discussion around that. And I think sometimes we need to take breaks from that and promote healthy communication, talk to them about their interests, talk about, positive activities that you might be able to engage in if you can, so that we're working on developing those healthy lifestyle interactions and behaviors.
And another point I would like to add is a lot of people there's a lot of judgment. There's a lot of people over the years say, I know what I'm doing isn't right. I don't know how to stop. And that need is so powerful. So another important piece is the person's already judging themselves. The person already is not feeling good about their choices. And so when you come at a stance of empathy and compassion, that really can also help with hey, maybe instead of all the talking sometimes is let's go out and do something fun. Let's do some hobbies. And sometimes that gets the family out there in a different way instead of, because even working in different outpatient settings, it's like, are you guys talking? Besides talking about treatment and what you're learning, what are you doing for fun? How are you re-engaging back together again, or back together with life again? Because hobbies is something that, no, as an adult or young, when I got all my classes and I got to do this, we don't think of, oh, let me just kick back and, go to the movies or go watch a show or something like that, because I got all these priorities. So it's another spice of life.
Well, and that's where we hit those feel-good chemicals that are natural, that have probably been depleted with isolation and remote learning and stress. So I think those are important takeaways too. And I want to just mention, as we're closing up here, Amber does have openings for consultation sessions. If you have concerns, for more information or to schedule an appointment or a consultation with one of our clinicians or with Amber, you can contact us at www.konickandassociates.com. And we do have a contact form on our website. You can call us at 630-206-4060. And you can email us at info@konickandassociates.com. And then our final session, I just want to wrap up. We do have one more session in our risk series. It's going to be on March 10th at noon, and we're going to be talking about the warning signs of depression and risk for suicide. Amber's going to be with us then as well. So thank you very much, Amber, for joining us today and for sharing your knowledge and wisdom, and feel free to connect with us. If you need those references or resources, please feel free to email us, and Amber, we can get those on our website too.
Thank you, Lisa.
Thanks. Take care.